Hello everyone and welcome back to the channel. I'm Dr. Tomislav and today I want to explain one treatment that many patients ask me about, PRP treatment for joints. You may have heard people say PRP can heal arthritis or PRP is a natural alternative to surgery, or sometimes quite opposite, PRP does nothing. The truth is usually in medicine somewhere in between. So in this video I want to explain very simple and professionally what PRP actually is, which joint problems it may help, what the treatment process looks like, what results are realistic, and when PRP is not the right choice. So let's start with the basics. What is a PRP? PRP stands for a platelet-rich plasma. It is made from your own blood. A small amount of the blood is taken, processed in a centrifuge, and concentrated in the way that plasma contains much higher level of platelets than your normal blood. Platelets are best known for clotting, but they also contain many biologically active proteins and the growth factors who are involved in a natural tissue healing. So the idea behind the PRP is simple. We take a concentrating healing component from your own blood, we inject it to the painful area, usually it's a joint or surrounding tissue, in attempt to improve local biological healing environment to reduce your symptoms. PRP is not a magic and it's not the same as growing a brand new joint. When people talk about PRP for joints, the most common use in orthopedics is a knee osteoarthritis, especially mild to moderate arthritis. This is actually the area where the evidence is currently most supportive. The American Academy of Orthopedic Surgeons states that PRP may reduce pain and improve function in symptomatic knee osteoarthritis, although the strength of evidence remains limited due to variability of the studies. So yes, there is an evidence, but it's also not a miracle cure. That means PRP may be a reasonable option in the right patients, especially for someone who has ongoing joint pain and wants to stay active, and is trying to delay or to reduce the need for more invasive treatments. Now, can PRP be used in other joints such as shoulder, hip, or ankle? Yes, it can be used in selected cases, but the evidence is less consistent. In many situations, PRP is better thought as a symptom management tool within a broad treatment plan, not as a single universal solution. In my opinion, the best PRP candidates are patients who has a mild to moderate joint degeneration, persistent pain despite good rehab, a strong desire to stay active, and a realistic expectations. A patient who understands that PRP may help with the pain and function, but may not completely remove the symptoms, is often a much better candidate than someone who is expecting miracles. On the other hand, if the joint is severely damaged, very stiff, deformed, or the pain is coming from a different source altogether, PRP may be much less predictable. In those cases, other treatments may be more appropriate. That is one reason why a proper diagnosis matters far more than just simply asking, can I get a PRP? The process itself is very straightforward. First, we take a blood sample from the patient. The blood is then processed to separate and concentrate the platelets. After that, the PRP is injected in the targeted area, and in some cases, especially for precision, ultrasound-guided injection may be used. Patients often ask, is it painful? The answer is not. It can be uncomfortable, a little bit sore, especially depending on the joint and exact area being treated. Another important point, PRP doesn't usually work instantly. This is not like a painkiller or anesthetic that switches pain off immediately. In fact, some patients feel temporary soreness after the injection, and improvement often becomes visible after several weeks. Johns Hopkins Hospital notes that for the joint injections, results are most often visible after several weeks, and they are not permanent. Some patients need to repeat the treatment depending on condition and response. What results are realistic? This is where I think patients need honesty. If PRP works well, the typical goals are less pain, better mobility, better tolerance for walking, stairs, gym, or day-to-day activities, and in some cases a delay in moving to more invasive treatment. What PRP doesn't guarantee is complete reversal of arthritis or permanent elimination of your symptoms. In fact, one of the biggest problems online is overselling. Some commercials make PRP sound like it can regrow your cartilage in a dramatic way, or it can replace surgery in every patient. That is simply not how evidence-based medicine works. The current evidence is more measured. PRP appears promising, especially for mild to moderate knee arthritis, but outcomes can vary depending on the joint, diagnosis, severity, the PRP preparations, and the patient overall biology. Is PRP safe? In general, yes, PRP is considered a low-risk procedure, mainly because it uses the patient's own blood products. That lowers the risk of allergic reaction compared to some other injectable substances. The more common side effects are usually temporary: soreness, bruising, or irritation at the injection site. Less common but important risks include bleeding, infection, tissue irritation, or a nerve injury, which are similar to the general risk of injection procedures. It is also important for the patients to know that PRP is widely used in practice, but for many orthopedic indications, it is still considered investigational, and insurance coverage is often limited or completely absent. PRP should be combined with. This is a very important clinical point. PRP should not be viewed as a standalone miracle injection. If a patient has a joint pain, the overall result is usually better when the PRP is placed inside of the proper treatment strategy. Accurate diagnosis, activity modifications, targeted physical therapy, strength work, mobility work, weight management when relevant, and a good load control. In other words, PRP may help the joint, but the patient still has to help the joint too. My practical message to patients. So if you ask me, doctor, do I need a PRP for my joint pain? My answer is sometimes yes, in the right patient, for the right reason, and with the right expectations. It may be useful, especially for mild to moderate joint degeneration, particularly in the knee when we are trying to reduce pain, improve function, and stay active without rushing too quickly into more invasive treatment. But it's not a cure-all, and it should always be chosen based on a proper examination, proper imaging when needed, and a realistic discussion of alternatives. If you're dealing with a joint pain and you're wondering whether the PRP is appropriate for you, the first step is not just booking an injection. The first step is getting the right diagnosis. Because the best treatment is not the newest treatment. It's the treatment that actually matches your joint, your symptoms, your stage of disease, and your goals. Thank you for watching. If this video helped you understand PRP more clear, make sure to like, subscribe, and share it with someone who is trying to decide between injection, physiotherapy, or surgery. And if you would like a proper orthopedic assessment, feel free to contact us directly.